My name is Michael Savell. I'm a nurse practitioner student at Auburn University. I want to talk to you briefly today about the drug class retinoids. There's three different generations in the class of retinoids. The first generation are drugs like isotretinoin and tretinoin. The second generation is acitretin. The third generation are drugs like tazarotene and bexarotene. The actions of these drugs are all very similar. They're all designed to act in epithelial cell tissues on the growth and proliferation of cells. Some of the oral medications also act on oil production in the skin. As far as the therapeutic effects, the thought behind these drugs is that they reduce the skin cell destruction or skin cell life, which ends up unclogging pores or keeping pores from being clogged. And with the decrease in oil production, there's thought to be less bacteria in the skin, and it decreases inflammation. As far as the pharmacokinetics or dynamics of this retinoid class, all of these drugs work in epithelial cell tissue. They bind to receptors in the nucleus to basically slow down cell growth and cell destruction. The pharmacokinetics, the topical medications are absorbed in the skin. This is very localized. As far as the distribution, these topical drugs stay in the same spot for quite some time. The onset of action varies. It depends on the drug itself. Some of these drugs are creams, gels, foams, liquids. The oral medications, the oral retinoids, these drugs are absorbed through the GI tract and the intestines. Their distribution is more systemic. They have to go through the body to make it to the epithelial tissue. All of the drugs in this class are metabolized through bile in the liver. The half-life of these drugs varies. A lot of these drugs have short half-lives, 3 to 4 hours. Some of these drugs have half-lives as long as 3 to 4 days. As far as excretion, all of the retinoids are excreted through feces as waste. With pharmacotherapeutics, these drugs come with several precautions. Photosensitivity is a huge issue with retinoids. We need to make sure when we're prescribing these drugs to patients that they're aware that they're not supposed to be out in the sun on these medications. If they have beach trips planned or anything like that, they need to make sure that they stop taking these medications for several days before they go out in the sun. We also need to warn our patients about using these drugs in sensitive areas like mucous membranes. These drugs need to be kept out of the eyes and the mouth and the nose. These drugs are contraindicated in women that are pregnant and breastfeeding. We need to make sure that our patients know that most of these drugs are pregnancy category D. However, there are drugs that are pregnancy category X, like bexarotene and other drugs in that class. As far as adverse drug reactions, most of the reactions are related to the skin. We can see skin burning. We can see acne breakouts. We can see sloughing off of the skin. Pretty bad stuff. A lot of these drugs can come with anaphylaxis warnings. There's several black box drugs here. If we ever have swelling of the throat or the tongue, we need to make sure that we seek emergency medical care immediately. Drug interactions in this class. Retinoids are known to have interactions with vitamin A because they're derived from vitamin A, so we want to make sure that we're not on vitamin A supplements. We want to make sure that our patients don't overdose on vitamin A. We also want to teach our patients not ever to take these medications with over-the-counter skincare products without first talking to us. Indications for use. We want to use these drugs for anything from wrinkles and aging to acne treatment, psoriasis, Kaposi sarcoma, T-cell lymphoma. As far as the rational drug selection, drugs like bexarotene can be used for the cancers like T-cell lymphoma. Also, allotritinone is used for Kaposi sarcoma in AIDS patients. Tretinoin or isotretinoin like Accutane, these drugs are used for acne. So these drugs have a lot of different treatment options, a lot of different things to use. We want to monitor our patients very closely for skin problems. We want to make sure that the skin is not being damaged further by overuse of these medications or side effects. Drugs like bexarotene, we want to watch patients with diabetes. They're known to cause hypoglycemic events. As far as patient education, like I said earlier, we want to make sure that we teach our patients to stay out of the sun. The sun is very dangerous for these drugs. We want to make sure that we teach the application correctly because there's a wrong way. and a right way. We want to make sure that we don't mix these drugs with topical cleansers and other cleaners that are over the counter, and we don't want to use the topical medications on mucous membranes, cuts, or sores. The main takeaways: don't get in the sun, don't use these drugs with cuts and sores, don't overuse these medications, and watch out for black box warnings. If you have any problems like anaphylaxis, seek medical care immediately.